Hello. Today we will talk about the frontotemporal dementia, which is the fourth common form of dementia and tends to affect younger ages. Researchers have used various terminologies before concluding to the name that has prevailed until today. First, let's see the history of the disease. The first name of the disease was Pick's disease. The name was given by the Jewish Czech psychiatrist Arnold Pick. Pick studied medicine in Vienna, where he acted as an assistant to Professor Maynard, and in 1878 he became a professor in the Medical School of Prague. In 1892, Pick first described this disease after studying a patient with progressive loss of memory and speech. During the patient's autopsy, he discovered atrophy in the frontal and temporal lobes. In 1911, Alois Alzheimer was the first to describe the histopathology in such cases, which he named Pick bodies. In 1926, Onari and Hugo Spatz, and in 1927 Schneider, continued to establish this clinical pathological relationship. Thus, the name Pick's disease was established for the following years. In the 80s, there was a significant development and improvement of technical neuroimaging, and in 1986, a large study was developed in Lund, Sweden, which resulted in 1994 and became the first scientific endeavor that helped in the diagnosis and classification of early dementia. This was the Lund and Manchester criteria, resulting from the collaboration of teams from both universities, Lund of Sweden and Manchester of England. These criteria were further improved in 1998 when Professor David Neary and his associates published diagnostic criteria which laid the foundations for the scientific community and research on dementia, and that's how the current name frontotemporal dementia was established. Now let's examine this disease in detail. This disease is a neurodegenerative disease during which long-term molecular and cellular changes develop in the nervous system. There is a gradual cause of nervous cell destruction in the areas of the brain, which are called frontal and temporal lobes. Based on the first appearing symptoms as well as the type of aphasia, which is a speech disorder, the disease is distinguished in 5 basic clinical syndromes: the frontal form, the semantic dementia, the progressive non-fluent aphasia, the cortical atrophy, and the motor neuron disease. Generally, main symptoms are emotional changes, inappropriate behavior, loss of interest for personal care, apathy, loss of empathy, compulsions, and changes in dietary habits. In addition, there are difficulties in memory, language, writing, decision-making, movement, and recognition of people or objects. It is worth mentioning how in recent years, genetics has evolved significantly. Despite the heterogeneity observed in the image of frontotemporal dementia, 3 genes were found that are frequently involved in the pathogenesis of the disease. The diagnosis is usually made with a combination of various findings. The steps that are usually followed are the clinical examination and the medical history, the neuropsychological examination, the blood examinations, and the brain MRI. Depending on the symptoms, other tests are often performed, such as cerebral blood flow scintigraphy and electromyogram. Treatment of the disease is limited to the improvement of the symptoms and the maintenance of the functionality of the patients. The drugs usually given are antidepressants such as citalopram, sertraline or paroxetine, antipsychotics, and anti-Parkinsonian drugs. And when it comes to nutrition, the basic advice is a balanced diet with a variety of foods. Frontotemporal dementia accounts for 5 to 10% of all dementia cases, but has several peculiarities. It is the second most common form of neurodegenerative dementia in younger people and the only form of dementia that occurs even in puberty. About 60% of sufferers are between the ages of 45 and 65, with the same incidence rates as Alzheimer's disease. If you want to be part of a wider scope to inform and interact with professionals worldwide regarding matters relating to the challenges of dementia and other related diseases and handling suggestions, just subscribe, click like, and hit the bell to become part of the memory team and community, a wider community with an excellent purpose.